So do you remember who you're filming first?
You're going.
Me, then you.
Here we go. We're going. Oh, I'm the video girl. Here's our audience. Okay. Now you. Okay, go.
After having surgery can certainly be apprehensive for anyone, especially being put to sleep. Today, more and more certified nurse anesthetists are performing this highly complex procedure. Many of them are working independently without the direction of an anesthesiologist. In the OR, the CRNA carries out all of the same functions as a traditional anesthesiologist. Their responsibilities are many and the risks are high. They are highly trained and skilled nurses to provide a safe and pain-free experience from surgery. The best way to show the extensiveness of their training is to walk you through how they prepare for a patient. Recently, I spoke with Rob Ivy, a certified nurse anesthetist with Baylor Health Systems, and he said that before setting up a case, he uses an acronym called SAMTIDE. The S stands for suction, A stands for airway, M stands for machines and maintenance, the T stands for tape, I stands for IV, the D stands for drugs, and the E stands for his equipment. He has to make sure that all of his equipment is working in order and he has all these things. He uses this acronym every time he feels that then he has everything that he needs to perform his job appropriately. After he does this, the next thing he does is he reviews the case. He checks for allergies. He's checking to make sure that there are any past cardiac or respiratory issues that may cause complications during the case. And he's also checking for past complications of anesthesia. Equally as important before the case is what happens inside the OR and what he does. The big question is, well, who is giving me the anesthesia? Helen Littman says that CRNAs administer nearly 2/3 of all anesthetics in the United States today. That means that they are giving over half of the anesthesia versus what an anesthesiologist does. The primary responsibility for the CRNA in surgery is to the patient. They're placing EKG leads, they're putting on the blood pressure cuff, they are using the pulse oximeter. They're also, then what they do when they do all that is they start induction, which means that they're going to go ahead and induce the patient, and they're going to give them 3 common drugs: Versed, fentanyl, and propofol. Once they are intubated, they hook up their anesthesia machine, and this machine provides them mechanical ventilation, and it provides their anesthetic gas. Once surgery is over with, they adjust their ventilator, they give them some Zofran, and then once their breathing stabilizes, they remove their ET tube, they check that their vitals are stable, and then they transfer them to the PACU unit. Within the PAC, once the patient is stable and they're breathing normally, and they transfer them to the PACU unit, they're in recovery. They're managing their pain. They're using morphine and Dilaudid usually. Those are the typical drugs that they are using to manage this. And they give a report to the PACU nurse. They're leaving them with standing orders for blood pressure, standing orders for respiratory and pain issues should they arise, and they ensure the vitals one last time before leaving. Then they head off to the OR to close out the case and do any last-minute charting if they need to do. So today I've explained how a CRNA works in the OR setting. Clearly a CRNA plays a large role in the healthcare setting. CRNAs are the primary provider of anesthesia care in rural America, enabling healthcare facilities in these medically underserved areas to offer obstetrical, surgical pain management, and trauma stabilization. The American Association of Nurse Anesthetists says that in some hospitals, 100% of these services are provided by certified nurse anesthetists. Now you can see that the CRNA works in the OR setting to keep a patient under anesthesia and pain-free.